So, thank you. Cancer wellness is a comprehensive approach that complements traditional medicine by addressing physical, spiritual, emotional, informational, social, systemic, and practical needs. And these are collectively known as the 7 pillars of cancer wellness. Cancer wellness aims to empower individuals living with cancer, whether they are diagnosed themselves or have a loved one with cancer, to proactively implement positive changes that help them live well. So today we have a beautiful zoom into wellness, which is called Navigating the Complexities of Healthcare. Naviguer dans la complicité des soins de santé en oncologie. So it's my honor to introduce our special guests. So our first guest is Josephine Lemay Dactica. She's a coordinator of cancer and palliative care programs, implementer, decision maker for the CIUS de l'Ouest de l'île de Montréal. Excuse me. In her expertise of strategy, management, ambulatory, oncology, palliative, and end of life of nursing care. As a nurse since 2008, she's applied a patient focus and population accountability management style, actively contributes to continuous improvement projects in her workplace, where leverage may excellent communication, analytical, and innovative and organizational skills. Our second person is Carla Baquidran, is an associate director for the Department of Nursing of the CIUS de l'Ouest de l'île de Montréal. She holds a Bachelor of Science in Nursing and a BMA from McGill University. She possesses more than 24 years of experience in health sector, including 11 years in nursing team management, and her diversified background allows her to solidify her participatory management practice. Ooh, those words. So I would like to welcome Josephine and Carla. Thank you for this today.
Thank you, Sandy. So as a first, we're gonna Josephine will present to us a nice presentation we've prepared regarding the service offering at CIUS de l'Ouest de l'Île. And if you have any questions, feel free to ask them, as Sandy mentioned, in English or French, and we'll be happy to answer them during the presentation. Thank you. Go ahead, Josephine.
Okay. Do you see the screen very well? Everything is good? Perfect. Hi, everyone. It's a pleasure to be here with you. As you know, my name is Josephine. I speak French, so I will do the presentation in English. There will be a few French words. Feel free to stop me at any time and I can answer. And I even speak Creole. For those of you who speak Creole, I will answer in Creole too. So it's a pleasure to be here with you. As you can understand, I am the coordinator of the cancer program, palliative care and end-of-life care. So it's a very, very, very big program. But today we're going to concentrate our speech on cancer care, how it's developed, and what do we do. So for the first part, I'm really going to tell you how the systems work in cancer care. So I will talk to you about the PQC. The PQC, it's Programme Québécois du Cancer in French. So it's a Québécois program of cancer care. So it's a ministry program. So they plan for us what we should do in cancer. So when we said plan, that means when we investigate, how many days we should investigate, how we should investigate, what we should do once investigation. This is what we call a program. So I'm going to talk a little bit about that. I'm going to talk about our CIUS ODIM. CIUS ODIM means Centre intégré universitaire de santé et de services sociaux. This is a long words to say us. Lakeshore Hospital, St. Mary's Hospital. So, okay. So we don't need to go further, like, to know what we are talking about, but this is the CIUS. ODIM, c'est l'Ouest de l'île de Montréal. And after that, I'm going to talk to you about the oncology program at the Lakeshore. That means, what do we do at the Lakeshore? If you go now and want to see what's going on in our clinic, you can go and see what is it, the program. And the second part of the presentation, I'm going to talk about Santé Québec. I know you read the news. Probably you're asking yourself, what is that Santé Québec? So I'm going to talk to you about it, what is next, and what are we going to expect from that. So I'm going to start with the Programme Québécois du Cancer. So it's a ministry. There is a gentleman there they call Dr. Latre, who's been working in that program for years and years and years. He loved it. He's very dedicated. So he's like a vigilant policeman looking at what we do and how we do it. So the program operates under the Ministry of Health. And it's responsible for guiding, coordinating, and evaluating what the government will do, government actions to reduce the burden of cancer in Quebec. The program is supported by the Réseau Cancérologie du Québec and various community organizations. So, for example, the organization you are now, it's part of the program, because one of the mandate of the program is to go and to do this outreach we are doing now. So that means we are responding to the ministry plan by doing what we are doing now. Through its action plan, actions are structured into a coherent system that supports unifying vision for cancer care in the province. So what you should understand, because it's a program, what you get at the Lakeshore Hospital, at St. Mary's Hospital, it's the same thing you're gonna get if you go to the CUSIM, if you go to the Jewish, is the same plan. So that means the delay is the same, how we should investigate is the same, how we should move forward is the same. The specialists, they have the certification is the same certification, the same school for everyone. How they do the tumor board is the same. So this is a program. So that means the government makes sure that everyone gets treated the same way everywhere. So now we are at Sirius ODIM. How do you respond to the program the ministry give us? So we have a vision, and our CEO, probably you saw our CEO in all of the media sociaux, our director, because oncology program is under the director of nursing, our associate director who is here with us. We share the same vision. We are responsible of you. That means we need to be humane, committed to the community, and to embrace innovative practices to deliver the very best of care. So now we're gonna talk about research. We're gonna talk about clinical trials. When the chemo doesn't work, we need to find a way to get you to a research. If you want to get you to a clinical trial, this is our vision. Everybody got the best care and the care that you want. So that means if you don't want to go to research, we are not going to force you to go to research. But it's going to be a partnership between the person, the community, the family, and the care. Our mission at L'Ouest de l'Île de Montréal really is to foster health and well-being of individuals and communities, and to provide health and social services that are accessible. So everything should be accessible. And I talk a lot about delay. We're gonna talk about access. So now the government is trying to put in place, it's putting in place what we call guichets. So investigation should be the first porte d'entrée. How do we say porte d'entrée, Carla?
Entry point.
The first entry point to care. So it's the reason why we're gonna have one number one person answering your questions, and you want any type of investigation, it's going to well taken care of until yes or no there is a diagnosis. So if we go, this is prevention. If we do the screening prior, so that means the treatment came prior and the recovery came prior. So this is our mission. Our mission is access and foster health and well-being. So who does all of this work? It's us. You have the two of us here. So I don't even have my picture here because I'm in the lower level here underneath some pictures, but you have the big bosses picture. You have our CEO, Mr. Dan Gabé. And under Dan Gabé, we are under Marie-France Brisa, which is our Director General. And further on, we are under the DSI. This is the whole organigram because I'm looking at this Black lady here who was our old DSI, but we have a new DSI. Her name is Isabelle Caron, and I'm under that lady somewhere here. You should see my name. But this is what it looks like, all of those directors working towards the mission and the vision of our series. So it's a big series, and the whole black part is us. So we start from Saint-Anne-de-Bellevue and we go all the way to the eastern part of Montreal, where we have one CHSLD called Grace Dot. So we are the biggest CUS's organization in the whole Montreal in terms of space. It's not the one that has more money, but we are the biggest one. And we have 3 hospitals within our services. So we have St. Mary's Hospital, Lakeshore Hospital, and LaSalle Hospital. And we have a huge mental health program, which is the Douglas Hospital. We also have the whole care for the youth with us, which is Batshaw, which is like the DYP, but the English part of in the English version of the DYP for the young ones. And on top of that, we have mostly 17 CHSLDs and without the ressource intermédiaire, without all those things. So we are huge. A lot of people are working, and cancer care, it's part of the program under the director of nursing. Sandy, I don't know, do I have questions so far, or how am I doing in terms of presentation?
You're you're doing great, actually. There's no questions right now.
Okay, okay. I would love to have questions because I don't want to lose you guys, and because I'm explaining technical terms. If I am not clear, please let me know and then I can repeat again for you. It's important to understand who does what in order to know where to navigate when you have questions. So our cancer care, it's small like that. I put a few pictures for you. If you go to the Lakeshore, the lady you will see, it's the lady in between it in the middle here. It's Maya. She is the one who is the manager of the clinic. So you can just get to the Lakeshore. I want to see the cancer program. I want to see Maya. Everybody will show you Maya, but you can ask for my name too. I grew up at the Lakeshore. I started young, very young. So I'm not going to tell you my age, but very, very young. So almost everybody knows me there. I work a lot at the CLSC, mostly CLSC Pierrefonds. In my whole life, I was doing home care with mothers and babies. So probably I might come to your home when, you were having babies at one point. So further on, so this is the cancer care program. I would like to mention to you guys, we had those 2 little boxes here. I want to reiterate again because we receive a lot of help in order to build our cancer program. I should explain to you that from the community, we have the Wasi Cancer Network who help us a lot. That network has 3 hospitals in it, and it's funded by the foundation. And there is a gentleman, Wasi, who gave some money to. So those people that help us build the program, and they finance some of the people that sometimes we don't have money to finance. So they finance some administrative staff, they finance sometimes nursing for us in order to do strategic works. On our left, I need to tell you too that we have the foundation. Sometimes the foundation give us some money to hire, for example, at the Lakeshore Hospital, the foundation finance a massotherapist. She came 2 days a week and help. We have also a musical therapist, and she comes 3 days a week, and she's doing fantastic jobs. So just to let you know, so and I acknowledge and thanks those foundation. And I don't know, probably some of you probably gave some money to the foundation. I can assure you it's money well spent. And thank you very much for that. Thank you.
I have a question, Josephine.
Yes.
So you're saying that for the music therapy and the massage, so I guess when they're in the oncology department having treatments, then they would have access to the massage and the music therapy?
Exactly.
Yep.
Some of them, unfortunately, some of them, we just have one last week. Sometimes when chemo doesn't work, and then this is the time they had the serious conversation, and then now they decide to leave something for their kid, the grandchildren, or to leave.
Yes.
So they do what they call I forgot the name. They with the musical therapist, they prepare a song and decide to sing it to live for their loved ones,
Yes.
and they share it. And I'm telling you, it goes, you cannot stay, in French when you are hearing those songs and the voice and what they are saying in their songs. It's fantastic, fantastic work.
Okay. Thank you.
Carla, you want to say something?
Oh no, I saw a question in the chat, so I'm
Mm-hmm.
just gonna bring it here. Is the Lachine Hospital part of the network? So I'm answering that. No, Luigi, the Lachine Hospital is under the MUHC network
Exactly.
and not the West Island.
And
So
not the
just
West
yeah.
Island. We don't have Lachine. So
Okay.
how does it work? Like, in Maya's clinic. Alors, I'm saying the names for you to remember. If you go to Maya's clinic, and you go to the Lakeshore, and then I want to see Maya, and then this is the clinic. How does it work for a patient? Because you need to know how long it takes, okay? So usually we receive a consult in the clinic for a patient, okay? And we have an administrative agent who will triage the question with the doctors. They will sit, and the first booking is made. The first appointment is less than 7 days for the patient to see an oncologist. The first appointment is booked in the clinic, so they will give you information where to go and everything, and then you will show up in the clinic. The clinic is at the back. It's on the rez-de-chaussée, the first level of the Lakeshore, but at the back. So once you get there, if you need additional tests and things to do to confirm the diagnosis, it's going to be taken care of, not only by the receptionist, but also by the nurse, who will make sure that the test is done within the delays you should have in order for the doctor to decide. So now the doctor, if the doctor, sometimes the result is clear and the doctor diagnoses you right away, but sometimes it's not diagnosed right away. They have to go to what we call a tumor board. So all of those big minds sitting somewhere, it's like in a movie, if some of you look at the movie. So they sat there, and then they discuss about the case until they find the correct diagnosis and decide of the treatment plan. So once they decide, so they have to sit with you and your family and decide the treatment plan. It's decided between the doctors and the patient, and they start the treatment. At the Lakeshore, when they start the treatment, you will see only one nurse. It's what we call primary care nursing. So that nurse, it's Heather, Hillary, whatever the name, Eliza. You will know that girl until you cured. So you will have the same person, which is a great continuity of care, because at the end of your second treatment, you know what's going on in the clinic and you became part of the clinic. Within the clinic, we have the nurses, but we should always remember the pharmacists because we cannot do oncology without the pharmacist. The pharmacy is located inside of the clinic. So the pharmacist will come and see you and discuss with you. Sometimes some of the treatments are very expensive. So the pharmacist will manage with RAMQ and all of those things to find out a way for the person to have the treatment. So we have also the musical therapies, the massotherapies. Sometimes we have to call a social worker on board. We are trying at the lecture to have a psychologist, but this is one of the money research that we should do in the future to have one. But at St. Mary's, we do have also a psychologist. We have what we call spiritual care who come and help, depends of the needs, depends of what we have to do. And we also have a family counselor who, when we have a mostly young patients, she does fantastic work with the wives and the young kids who doesn't understand what's going on with daddy or mommy. So she sat and stay with you. So this is our cancer program. It's a comprehensive, multidisciplinary, and community support for patients throughout and beyond their cancer journey. So that's what we are. And we are very proud of it. I already explained all of that without presenting the little picture. It's very nice. As you can see, the patient is at the center and we have all of those people rotate around. It's not only one. We have 4 pharmacists, 2 tech, 1 coordinator, and lots of people. But all I can tell you, you only have 1 nurse with you. And I think it's a fantastic thing. You're not confused, you're gonna come and see Heather every day. So where is Heather? How come Heather is not there? So sometimes we hear the patient saying that. So it's a fantastic care, and we became a family like that. So this is what we look like. Beautiful girls, as you can see, all of the colors in the world. So sometimes we have fun. Here, that gentleman you see here is the pharmacist, and we look good. We look good. It's a nice picture. And we do have fun too sometimes. We celebrate, we have fun. We do collect the fund also to support the foundation, because we are always asking the foundation for money. So the tumor site we treated and treatment we offer, we treat all of those tumor sites: breast, lung, colorectal, gastrointestinal, hematological, and many more tumor sites are treated. But sometimes we do have some rare type of cancer. When we say sometimes we have people who just win the jackpot at the lottery. Sometimes it happens too. So we even have people that we sent all the way to Toronto in the state in order to have their treatment. So that means wherever it is, the treatment, we're gonna find out where it is and bring you there. So that's a good point for us. So we offer chemotherapy, immunotherapy, oral therapy, hormonal therapy. And for radiotherapy, unfortunately, we don't have that in our CIUS at all, in none of our hospitals. So we send the patient to the CUSUM, MUHC, to have radiotherapy. So as I said, we look for treatment and we give treatment to the patient. So breathe, we do have research. We have St. Mary's Research Center, who we put a lot of patients on protocol. And we have St. Mary's Thoracic Research Program, and we have a partner at the Lakeshore for that. And we have also what we call la détection de la détresse, where we go to the patient and we go to the psychosocial level in order to know how the patient is really feeling. And with the report the patient gave us, we can present a treatment plan and discuss with the patient and go towards. So it's not only the physical part or the doctor giving chemo and everything. So as you can see, we really take care of the other aspect, which is the psychosocial. Is the reason why we have a musicotherapist, a massotherapist. It's to go beyond the level of the chemotherapy and to, you know, decrease the stress the patient is feeling. Answer the questions. The reason why we have only one nurse to talk to. And, you know, be there for you and go with you with that journey. And at the Lakeshore Hospital and St. Mary's Hospital, we have 21,699 treatment per year. And we have more than 37,000 people who visit the Lakeshore Oncology per year, which is a lot, if we are like, you know, considering that. We have lots of projects. I talked in the beginning about the screening project that I'm working, our team is working very actively to screen the patient before they start. You know, the same way all of the ladies can get screened for breast at 50 years old. So now we are working towards, like, you know, screening everybody, every smokers, you know, we screen them. So this is a project that we are working hard towards. We do the same thing too for colorectal cancer. So we are putting in place the investigation for lung cancer, breast cancer, colorectal cancer, prostate cancer, and gynecology cancer. I'm not talking about a long-term project. I'm talking a project that I should finish with all of those guichets by 2026, so beginning of 2026. So you will hear from me again once I have all of my guichets ready. I will come back here to tell everybody to go and get screened. And we are working towards, you know, as I told you, we are doing psychosocial treatments for our patients. We are working towards having zootherapy, having virtual reality experience. So that means we put those big goggles in front of the patient, and then they can go to Venice, Italy, but while sitting in their cancer care chair. And we are doing urgent care clinic. So I spoke already about musicotherapy. So all of this is happening at home. And I think I'm done. Oh, no, I'm not done. I need to talk about the changes in the healthcare system, but it's not as fun as myself. Do I have questions?
Yes,
Yes.
Josephine, we have one.
Yes.
Actually, it came directly to me, so maybe people are not seeing it in the chat. So
Mm-hmm.
Gurpreet is asking if our major surgery is done at the Glen or Maisonneuve Rosemont. It's far from the West Island. Can we approach CHSLD for post-care help at home, being alone, physiotherapy to regain strength? So what I answered for you, Gurpreet, is that usually the post-hospitalization treatment is organized by the treating center. So, for example, if you require home services or rehab services post-op, this will be organized according to your choice. If for you it includes like proximity to your home. So there's a possibility of proximity if it's CLSC, also the choice of available rehab centers as required, but not the CHSLD is not, it's a different type of care that's for long-term care, and that requires a long-term placement. If, let's say, your loved one requires that, then there would be another request for that. Okay? Sorry, go ahead, Josephine.
Okay. So thank you for the question. If there are anything you can tell me. So I am in the second part of the presentation, but it's not going to be as long and as passionate as the first part. It's talking about Santé Québec. Santé Québec is very new, and what I'm going to say tomorrow, it will change. You will see other things in the news very soon. But for what we understand, you know, Santé Québec is created in 2024, December 2024. So the ministry has that bill 15, and then Santé Québec is created. It's a government agency that oversees healthcare. So it's not the ministry who is going to operationalize things. So the ministry will have the big program. So that means, okay, you should do the program de cancer, but Santé Québec is the one who's going to say how we should do it. Okay, so all of the healthcare workers are under a sole employer, which is Santé Québec. And it's
I guess Josephine's is frozen.
There she is. She's coming back.
Okay. One moment, everybody. She's going to come back.
While we wait, does anyone have any questions that they would like to ask?
I mean, I can ask one. Oh, I see now a question
Okay.
for me that was sent. Is it easy to switch the lakeshore? So if you're another hospital and you're not satisfied with the services, would you be able to switch to another hospital?
Yes, it's
And
by the yes. So it's a request that you would make to have your file transferred to the another institution. So there are several networks, and if you started a certain treatment but you're requesting, then those files can be transferred.
And if those files are transferred, would that be a request with their oncologist or they would have to do it with somebody else?
Well, if it's usually through the administration or
Yeah.
while with the nurse that they can make a request and with the doctor. So it's a team effort to transfer the file.
Yeah, okay. And I had a question because when Josephine, sorry, was talking about funding where certain people had treatments and they were able to travel to go for treatments in Toronto and other places.
Yes.
Does that mean that your foundation will help these people to travel for their treatments?
No, it means that we acquire like where the
They're
system where they require their treatment. If it's not available, we're able to facilitate access to it.
okay.
Some of the foundation does cover certain elements, however, not a large scope in terms of travel, but there are some ways that we can access funds
Okay.
if that's an issue for the
Okay.
person.
Yeah, because I know the Canadian Cancer Society, sometimes they have certain things that they can help for funding
Yeah,
to travel for other treatments
that's
outside.
it. That's it. Oh, there she is.
Yeah. And do you know at the Lakeshore if there are specialists in endocrinology? Endocrine,
Yes.
yes,
There are
there is.
endocrine.
Okay,
Yes.
okay, okay. Great, thank you. That was one question. And I think you've been seeing more of the questions they've been
There's a
asking.
couple there, yeah,
You.
coming to me
Yes.
directly, which is
Okay.
okay, and I read them out loud. There was just a couple,
Yes,
so
yes.
I
Hi,
am
Josephine.
so sorry. I just like, this
Got
is
a
it's
froze.
okay.
technology. This is what we call technology nowadays. I'm so
It's
sorry,
all
everyone.
good.
I until today, I cannot explain what's going on, what happened. I don't know. So do we have some questions for me by the time for me to get
No, it's okay. There was a
running? But
couple. There
almost
were
I was almost done too with for the presentation.
okay.
Santé Quebec, yeah.
So what
Yes.
was the question I have?
Oh no, it's okay. There were questions about whether there's endocrinology at Lakeshore, which we have.
We do.
Yes. If the foundation covers transport costs for when we send people to Toronto, let's say Toronto for treatments, and I said there's some elements that they do cover and they don't, but we can inquire where we can access funding for those who need it.
Who need it? Yeah.
Yes, there are other services too.
I have another question because we did ask the question that if somebody wanted to be transferred to hospitals, that you had mentioned that through the doctor, the admin, but what if the doctor refuses? Where would they go? How, if the doctor refuses to refer them to another?
I don't think a doctor can refuse
No.
a
Okay.
person
Because I
to.
don't
It's
think a
always the
doctor
choice.
should not
No,
refuse.
it's always a person's right to have a second
Yes.
opinion. So that's part of the process. And
Okay.
sometimes we just transfer care too, like if the patient,
Yeah.
like I mentioned, patient requests to have their treatment closer to home. They've been going to the MUHC. Let's say
Yeah.
I'm just using that as an example, and they live in the West Island. Then
Yes.
they can have everything transferred to the Lakeshore and receive the same treatments there.
Yes. Yes. We have a lot of participants. Yeah, exactly. Which they're very lucky to have access. Yeah.
Yeah.
Okay.
Perfect.
There's a question on the chat for either Josephine or Carla, and I think it was already answered, but we can go over it again. So what about treatments out of the country? Does the foundation help with those costs?
Oh, yes. So we answered that. There's some elements that the foundation can cover and subsidize. However, if not, then we would look through other funding sources if it's an issue for that person for transportation.
Perfect.
Good.
Thank you.
I think you can continue, Josephine.
Okay, I was at Santé Québec. I was at that slide, but we're almost done. It's like really Santé Québec is aimed to make the healthcare system more efficient, improve access. We talk a lot about access to care. And the last one is to retaining and attracting healthcare professionals. You can understand once you have only one employer. So if I decide to go anywhere, I can go. If I move, I live in Vaudreuil. If I move from Vaudreuil and I decided to go and live in Abitibi, so I will not lose my seniority. I will not use my job because it's only one employer. So I don't need to go through the system again and have an interview so I can get transferred. So it's all of the things that a few healthcare professionals are looking forward to. The last part is not already in process yet, but it will come with time. Okay, so what changes with Santé Québec? It's really the quality of care, like the program I explained to you in the beginning. So would tell us how many days this, how many days that, what type of treatment we can have, what type of diagnosis, what type of test we should do, remain the same. So the patient will continue to receive the same service from the same health professional. The hospital, clinics, and other facility will operate as usual. There will be no changes in your appointment. Actually, if there are changes, it's going to be better because they want to improve access, so to go faster. Is the reason why they are funding for those guichets and to do a screening fast in order to get some result fast and then in order to treat faster. The goal is to improve efficiency behind the scene, not the patient care. And your healthcare team remain committed to provide the best possible care. So that means nothing will change. And to answer that person who asked the question about the doctor can refuse, a doctor should not refuse to send you somewhere if there is a better care over there, or there is a treatment that might work or that will work. They have to send you. At the same time too, if you decide to receive care closer to home, the doctor cannot say, no, I want you to come to see me instead. They should refer you to other specialists that is closer to home. So this is our title, La Force du Nous at CIUS l'Ouest de l'île de Montréal. And it was a pleasure to present what we do. And we will come back again and when we have other news for you. And feel free to give me a call or to stop by at the lecture and ask for Josephine or Maya, and then, we can talk.
So if ever anybody stops at the lakeshore, where are you at the lakeshore?
I am at the back of the center. So when you enter all the way, you should ask anybody to show you I am behind the ambulatory services at the ambulatory clinic. It's written oncology there, but you can ask any receptionist you see in the front of the ambulatory, where is the oncology? Where I can find Josephine or Maya, you will find us in the back.
Okay. Well, thank you very much for your presentation. Does anybody else have any questions? You can unmute yourself if you would like to ask the question.
It's Josie. I just want to say thank you. It's amazing how little I knew about all of this. Even though my husband went through it 15 years ago, this is just so good for me. Like, I feel reassured. Thank you.
Thank you very much.
Yeah, so my question was, I already took Sandy's help and I approached Sandy because I'll be going through another surgery. Last one was very major appendiceal cancer, 21-hour surgery at Glen. And now, unfortunately, my surgeon is moving. I didn't know he was like for fellowship here, but he did amazing job. And now he moved me to all of a sudden another far hospital, which is Maisonneuve Rosemont. But he said he did the best for me. So I have my surgery coming up June 20th again.
Mhm.
And the thing was that at that time, 4 days ago, before my surgery, I lost my husband at Lakeshore with lung cancer, and I was going through a big trauma. I was alone, and social worker she filled the forms for me at Glen that they will help me in every way possible. I had 72 stitches, open laparotomy. CLSC came, but the maximum they did was 3 times to teach me my ileostomy bag. And when I asked her that I need help, if somebody can like help me with the shower or sponge me and all these things for another few weeks until I gain strength, because I was used to have anxiety and shake a lot. Then they just, kind of shoved me away. I really approached them. I kept calling them. They say, oh no, we have more fragile people than you. You have your bathroom in the bedroom when they come to home. And she says, oh, I think you can handle yourself. And nobody, like, I was like that.
Dang.
Then I had to like call my mom, who is already 76. She used to help me a bit. And this time I'm so nervous again because she can't. My daddy is sick, so nobody can come. And that's why when I approached Sandy that what's will happen, and she says, then that's why I was asking question, can I be help from somewhere from CHLD? But yes, no. And then Sandy told me that ask them if they can put you in a rehab for a little more in somewhere in West Island convalescence. So that I was asking who
To
to.
stay in rehab.
Yep.
But you know, Mrs. Carr, I was telling Nadia and Sandy, those are the presentation we are doing today. We talk about oncology. I think it will be very helpful for every one of you guys, like, for Nadia and Nancy to continue this initiative. And each time we have the wellness video, the wellness presentation like that, to present something from one of the healthcare, because I do have colleagues in, the questions, it's really related to soins à domicile. And there is a lady like me who does that job.
Yeah.
Okay. Actually, it's a gentleman. His name is Michael Kim. So I see Michael Kim standing here and then answering your questions and find a way to answer and to give best care, because this is the way we prepare our program, we prepare our project. It's from what you need. We say, okay, we have 3 people, we want that. And then how can we answer them? And this is how a project started. You know what I mean? So you will need help post-surgery and you will need home care. And I think the new person that should come to talk to you, Nadia and Sandy, if you want, I can put you in contact. It's going to be soins à domicile for them to explain what they do, why they do it, and how they can help, and what are the needs that the people from the community needs.
Thank you.
In the meantime, though, Mrs. Carr, I would recommend that you, when you do speak with the concerns that you have post surgery, you should explain these prior to your discharge. So when they're planning your discharge home, you should verbalize really your concerns, what happened
Exactly.
last time. You'll know what state you're in, the difficulties
No,
that you
this time
had.
I'm really going to. That's why the first person, when they told me there's no choice, you have to go to similar surgery, laparotomy with HIPAC again, and I approached Sandy. The
Okay.
first person, that's my second home wellness center. That's I just gained all this strength from there, being like, strength and everything.
Mhm.
And thanks to my mom, she could help that time, but this time she can't. And that's the thing that was making me more nervous than going to the
Nervous.
second laparotomy again. And then Sandy told me that this is how you can approach, tell your doctor that after, if they put you 2 weeks there, send you to somewhere West Island or somewhere convalesce, and that should help you. Because last time to be honest, they abandoned me. CLSC kind of abandoned me. And everybody was shocked. My relatives from Ontario and everywhere, they say with such a major surgery, whenever you have like bypass or any bigger surgery in Ontario, they always give you home care, few hours at least a week. They come, like give you help with the shower, with little errands. And that was shocking for everyone. And then anyway, thank God I'm here, still alive, going for a second one. hoping the best this time, and I will say my voice to my doctor.
Exactly, which is very important
Exactly.
to advocate for yourself. So like they
Yeah,
mentioned,
because no, social
really
work is
encourage,
very
yeah,
assuring at Glen, and I thought all the paperwork is done, and they really asked me how many steps upstairs the house,
yeah,
blah blah
yeah.
blah, nothing.
Mm,
And then I
yeah.
was like, I didn't know. And then thank
But
God,
this
like family.
experience that you've had, yeah, you will see for the next time. Yeah. Okay. Thanks, Gurpreet.
Thank you very much. Yeah.
I have a question in the chat that says, I don't know if this can be answered, but I take blood tests at the hospital and then the next day I get treatment. Is it possible to get the blood test done at a location closer to home, results sent to hospital, and reduce driving? So just to answer
Exactly.
your question, then yes, definitely. There are different types of services, whether they're private or public. Sometimes you can see if there's a hospital center closer, or test center closer to home. As long as you have the requisition with the doctor that will that you need to send your blood test to, then you can go to any facility like that that's public, which does not cost anything. It will go through RAMQ. Or if you have private insurance, there are also private labs that do blood tests
Blood
and even
tests.
have services that can be done in your home if you want, if you're willing to pay, or if you have insurance that covers the blood test.
And I think if I need to add is that definitely to speak with your oncology team, because sometimes there's certain oncologists who really want you to go to your hospital to get the blood tests. So there's no,
No
don't
mistakes.
No
get the
mistake, or
results,
they get
mistakes
lost.
done. Yes, that they
Yes.
get lost and you cannot have a treatment the next day. So definitely discuss it with your oncology team.
Yes.
I can tell you, so this is our success. We hire infirmière auxiliaire, LPN, at the lakeshore. So we do the blood test for our patients ourselves.
At the hospital?
À l'intérieur même.
Okay. Okay.
So just because we want to make sure, because we were having too many problems when we were expecting the result, we cannot have the result. Chemo was prepared, and then and then we have to throw it away. So now we do our own blood tests
Okay.
for our patients. Yeah.
Perfect. So I think this will be for tonight. Thank you very, very much for their presentation. It was very interesting. We will, as we say, we've recorded it, and we will put it on our website. And thank you very much to both of you, and thank you everybody for attending.
Welcome. Thank
Thank
you.
you
It
for
was a
having
pleasure.
us.